Okay.
All right, I got your head. There you go. I got you. Let this side go. Mm-hmm.
Ooh.
I mean, this is substantial. So your quad on your left is at least 50% larger.
Yeah?
Can you see that? Can you see that? I mean,
Oh, wow.
this quad here is much more
right.
muscle, like
Really?
defined here. It's
Yeah,
like
you're
it's
right.
flat more on her.
Yeah,
So
I
I'm
never
just saying,
saw it like that, but yeah.
as I'm rubbing, I can really feel there's just so.
I would have thought it would have been the right.
Me too.
So this is I want to get the nerve. That's why we're gonna work on your lower back and hips again.
Okay.
And then we'll go face down. But I just wanted to
Okay.
see how these felt. But yeah, we'll get some. Thanks for traveling. Tell me about how you felt a little bit after that last. How'd you feel?
I felt initially centered.
Yeah.
You know, I felt, what was done. But I felt centered. I
Okay.
felt centered.
Okay.
Walking started changing, and so it was good. I wasn't in pain or anything.
All right, beautiful. Muscles do you think are the most affected? Your quads?
Quads,
All right.
yes.
Well, do you think it'd be okay if I maybe work a little soft tissue on those today?
Absolutely,
Okay.
yeah.
So we're gonna
Yeah.
work on any big muscle groups like that. You think,
Absolutely.
if we can sort of flush out anything that's in those muscles that's causing that
Okay.
inflammation and see if we can clear it a little bit more.
Okay.
And we're just gonna start on your back again and just go through your spine.
Sounds
And
good.
if I'm going too hard, let me know again. But I'm gonna go a little bit deeper today.
Okay.
Just, we've been through that first visit, first time been adjusted. We're gonna go a little deeper
Okay.
today. And then exhale for me. Let all the air out. There we go. All right, deep breath in. Head back for me. Exhale. Let it all go. There you go. Very good. Much better.
Yes.
Deep breath in. Exhale. Good. Stay there. Let me stay there. You okay?
Okay, yes.
Okay, good. Stay with your head. There you go. I got you. Let this side go. Mm-hmm.
Ooh.
He was so nice the first visit. Again, now he's all aggressive and mean. I want my sweet Dr. Ed back. I know. I know. Turn your head right a little bit. There you go. Good. I'm just going to rub this for a second. There you go. Let that tension go. There you go. Right there, yeah. Yeah, right on that attachment there. There you go. Oh, real easy. Let me have your head. There you go. There we go. Very good. All right. Yeah, polymyositis, it's like poly many, right? Mya, muscle.
Right.
Itis, inflammation, so
Yes.
we use Latin to confuse people. If we translate to English, it's, many muscle inflamed.
Right, there you
Right,
go.
that's all it
yes.
means. It's not doesn't sound scary anymore.
No.
The muscles are on a 4 to 6 week replacement cycle. And so your body's continually making like skin. You make new skin and it replaces and your muscles replace, and the idea and trick is that we can try to you actually can speed up muscle replacement if there's enough blood flow, if the
Right.
nerve's healthy, if you have a good nutrition.
Okay.
And so I want to talk a little bit about those three components to tissue health comes from one, we call them the 3 T's in chiropractic. You have thoughts, traumas, toxins, right? So your traumas, injuries we have to our spinal column, our nervous system, toxins, things that we put into our body, things we can't get out of our body, and then mental stress. And those 3 things affect the health of our body. And when we're talking about tissue like muscles, the muscles need blood flow, right? If an area has no blood, if you had a cut on your arm here or damage to that muscle and I put a tourniquet here, that cut would never heal because there's no circulation.
Right.
Circulation has to be there to bring the nutrients in and take the old stuff out. If there's no nutrition, if your diet doesn't have any good materials, right, your body can't build the muscles up if there's no internal materials to use to build muscle. So there's the nutritional component, and then you have the nerve flow component coming from your spinal column, almost like the power of electricity. Does that make sense?
It does.
So if there's no nerve flow, it's the same as if there's no blood flow. And so that's why I rub your neck and why I'm adjusting you. This whole purpose is to try to take pressure off the nerves. I put it in a more simple word I call cleaning the spine. What I mean by cleaning the spine is that there's no tenderness alongside your spinal column.
Okay.
When I rub your neck, when I adjust you. Yeah, a lot better. Yeah, not a little bit right there, a little bit coming out right here at the top. But
Okay.
yeah, we're gonna just don't want any congestion. A little bit of congestion right there. I've had doctors ask me, how often do you re-examine your patients? Every 10 visits, every 15 visits? I'm like, every visit. I don't wait an arbitrary number of visits before I'm gonna reassess you, right? So today's assessment is right there. It's a little tight.
Do you have a goal for your muscles? Has anyone?
I do.
Yeah.
My ultimate goal, of course, is to loosen up. I've kind of been feeling this for a few years now, and I just felt like if I could get a good stretch, if I could get these muscles moving, I can get on my feet again.
Yeah.
That's the biggest thing. And be comfortable. Ooh.
Just sort of combing the tissue, just seeing how it,
Okay.
trying to get some blood flow, stimulate the skin, which then stimulates the internal circulation. There we go.
What's it feel like?
Like lumpy.
Yeah.
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 Okay, gotcha. Right there, yeah. Yeah, a little lumpy here on this brachioradialis here. Left doesn't have, feel the
As
difference?
much, yeah.
Yeah, this is a little bit more
I
right
feel
here,
it,
yeah.
mhm. Is that fatty tissue or something?
Well, like I said, if there's lactic acid or any other type of irritant in the tissue,
Right.
the body, the immune system could recognize it as something foreign or bad, and it starts attacking, and then, the bacteria eat stuff, and then, their waste can be damaging.
Okay.
I don't think we really fully understand what causes the damage. Internally, it could be like I'm just talking out loud, I'm thinking out loud here. It could be like a diaper rash internally,
Okay.
kind of idea, and that's what irritates the tissue. So trying to flush out any irritants, we call cytokines is a fancy word for meaning inflammatory mediators or chemicals that,
Okay.
we're just trying to, and then like I said earlier, 4 to 6 weeks is how long it takes a muscle to replace.
Okay.
But you can speed how quickly a muscle replaces if
Blood flow?
there's increased blood flow, if the
Okay.
nerves are happy, if you're eating good food.
Okay.
I frequently have people in car accidents, and 2 weeks later they'll be almost back to normal if I treat them right away.
Yeah.
And if we can get ahead of it and not let the body keep all those inflammatory chemicals in the tissue after a whiplash. Similar to, say, dishes. If you have a dish and it's dirty and you rinse it off and put it in the dishwasher right away, it's not too hard to clean it. But if you let it
Right.
sit in the sink for a
Yeah,
week
hard.
and everything crusts over, it's like, okay, now we have to scrub.
Yes.
Right, so it's how long you let things reside in there can affect the health of the tissue. And I'll work the tricep face down, but I just want to
Okay.
work the bicep this way, and then I'll work the back side in a minute. Got you right there. I'll work that a little bit. Mhm. Just trying to increase some circulation in here.
Okay.
Wash it out. You feeling okay?
I am. Thank
All
you.
right, all right. I got you. There you go. All right, I'll put your hand back on your belly for you.
Okay.
If you're super tender tomorrow,
Right,
after
yes.
doing this, then
Okay.
we want to continue doing it until
Okay.
there's not that tenderness in
Tender.
here.
Okay.
The tenderness represents the internal blockages, and
Got you.
so. And this muscle's a lot bigger, right?
My left. Which
your
one?
left is
The
larger,
left?
right? This
Ye-
is
Yes.
muscles. Your quad is larger. The right's more,
Yes.
which to me makes more nerve sense. Does that make
Okay.
sense? That the nerves are causing it.
Okay.
So the discs in our spine will go they'll go left,
Got you.
they'll go right.
Okay.
So the nerve is more aggravated on the right. And this is substantial. So your quad on your left is at least 50% larger.
Yeah?
Can you see that? Can you see that? I mean,
Mhm.
Oh,
this
wow.
quad here is
Oh, yeah,
much
you're
more
right.
muscle, like
Really?
defined here. It's
Yeah,
like
you're
it's
right.
flat more on her.
Mhm. Yeah,
So
I
I'm
never
just saying-
saw it like that, but yeah.
As I'm rubbing, I can really feel there's just so.
I would have thought it would have been the right.
Me too.
So this is I want to get the nerve. That's why we're gonna work on your lower back and hips again,
Okay.
and then we'll go face down. But I just wanted
Okay.
to see how these felt. But yeah, we'll get some. Okay.
Yeah, I can feel a difference.
Yeah, there's just a lot larger muscle on this left side.
Mhm.
These feel good. You know, they don't really. You don't really.
Okay.
I mean, almost say this is a normal level of muscle here. I don't have a.
Okay.
I don't feel like there's much diminished here than most tibialis anteriors that I feel.
Okay.
And they feel pretty symmetrical. But the right quad definitely is diminished.
Wow.
They feel about the same. A little bit of a dent right there. That's what creates that click right there. You
Right,
actually
yes.
had I wouldn't consider this part of this is something separate. Like on top of everything else you've gone through,
Right.
there's actually a tear in the hamstring.
Oh.
Okay. Yeah, your calf on the left is much larger. And the right calf is.
On the left
Yeah.
is larger?
Left is larger. Yeah, left quad was larger. Left calf is larger. The right.
Okay.
This right calf is definitely. This is
Mm.
a lot of muscle right there, and then not as much on your right calf.
Hmm.
Probably the same, a little bit. Not as much on the hamstring. There is a little bit less here on the right hamstring.
Okay.
There you go. Yeah, you've you've had an injury outside of all this right here.
I'm trying to draw my head.
Something dented this. So, like I was saying, that your left side is higher, and we're in left avoidance, right abuse, and so that atrophy we're seeing in the leg is because the right lower part of her back is more stressed, the nerves are more inflamed, the signal isn't as clear. So if we can redirect some of the pressure back to the left side, then we can balance it.
How's the pressure?
Okay. At the end of your thoracic cage and the beginning of your lumbar is right here. We call this the thoracolumbar junction. And
Okay.
typically anatomically, it's the weakest part of the back. It's a weld or a junction between one set of vertebrae type and another set of vertebrae. And if you look at the last thoracic vertebrae, T12, and the first lumbar vertebrae, L1, they're kind of hybrids. They kind of look similar to each other in the sense that they don't really look like a lumbar vertebrae, they don't look like a thoracic vertebrae, and typically this area tightens the first. I see this area lock down as one of the first areas that locks down, and then as a result, the lower back gets overstressed. That's what affects your legs. So restoring some functionality to the thoracolumbar junction,
Okay.
getting the inflammation out of here, soreness. Okay. Here we go. Doing great. You're tough. Whew. Medically, we call it the conus medullaris, is the end of your spinal cord, and then it becomes individual wires as we go down to your tailbone. And so the nerve that actually comes out at L5 starts at L1, right where the end of the spinal cord is, becomes individual cables, travels down, and then exits. So I look at that as also a contributing factor for why inflammation of this region can actually irritate the nerve coming out in the lower back, because it actually starts right here.
Okay.
Unlike in the upper back, the nerve that comes out at that level starts right off the spinal cord at that level.
Okay.
We call it the cauda equina. So equina means horse, cauda means tail. So we call it the horse tail. The actual spinal cord looks like a bunch of fine hairs.
I know horses, and that's true. They don't have one long, it's a bunch of hairs.
Bunch of hairs. So they named it horsetail.
Okay.
So the end of your spinal cord, so it's one long, it's all encapsulated inside of a tube.
Okay.
It ends right at L1 and it bulges and then it becomes individual cables. So the cable that comes out way down into your glute actually forms off the conus maxillaris up here at L1.
Okay.
Travels down 4 or 5 inches and then comes out. So everybody looks at the level down here and goes, that must be where the nerve's pinched as it comes out here. But I go, what happens if there's inflammation and soreness and just at that wishy-washy junction between the end of the thoracic cage, beginning of the lumbar, at the same point where the nerves form? Like I said,
So you're saying it could be something there.
nerve pressure here. You can the nerve isn't. If you whack your funny bone, you feel it in your fingers. You can whack it up here and you feel it in your fingers. You understand? The nerve, any place along that path of that nerve, the nerve can be irritated to cause a symptom of, weakness or much better than last time. There we go. This is what I try to tell people eventually, there shouldn't be a mark. Why can't I create any marks on you? There's no marks because internally
You cleaned
it's
it.
already cleaned. Yep. A cup of ice cream at the end. Ah, yeah. Don't end the meal with broccoli.
Is that part?
Even though I love broccoli, but don't end with the asparagus.
Yeah, no.
I want the last taste in my mouth to be the ice cream. Yeah.
Yeah.
That's the secret. Gluteus medius muscles definitely more contracted on the right,
So they might have to do it.
irritating the sciatic nerve and right there. Right here. How often do you try to swim, or have you been in the pool in a while?
I haven't been in a while, but I do like to swim.
It's a good way to exercise without putting a lot of stress on your spinal column. Does that make sense?
Yes.
To be a way to. Do you have a community pool or anything you can access? Know any pool you can get to? No?
I have a swim spot.
Okay, I'm just saying if you can, even just doing like a water aerobics or something like that, be a great way to build your body back up.
Okay.
At least create a demand. In order for your body to build itself up, you have to create a need. Does that make sense?
Yes.
And moving our body, sometimes if we're in pain, obviously that'll keep us from moving, but if it's just weakness, then getting your spine clean, getting everything moving, and then creating that, and then the water obviously is just a lot less likely to hurt yourself.
Right.
It's a safer environment. There's a resistance that water provides. You can get a good workout for your muscles, your legs, just fighting the resistance that the water provides, and that's something I would recommend you to try to find a water aerobics or some sort of water. That's the best.
Okay.
Yeah. when there's actual damage to the extremity, I usually can either feel it or I'll see it.
Okay.
And so, because there's not a huge amount of marks coming out on your extremities,
Yeah.
this is why I really blame this on the nervous system.
Okay.
Makes sense. If there was a lot of, damage to the actual tissue in here,
Right.
then we should. I mean, I do feel some. I'm not doubting that there's some, but I'm just saying there's.
Okay.
I think a larger percentage of this is coming from the brain, body, spinal cord, muscle connection,
Okay.
and getting
Right.
the spinal column as clean as possible. Ideally, we could start with a pool noodle or something, arching on your back, starting up here
Okay.
on maybe your bed, and you just kind of roll your
Okay.
back up and down,
Okay.
just trying to get some blood flow, and
Okay.
again, creating that demand, moving your joints, then the joints will have to strengthen themselves. It's the same way you keep muscles strong and bones strong, we have to create a demand. You have to,
Okay.
and it's just, and it's hard to move, and so it's hard to get the ball rolling. Once you get the ball rolling, you'll be able to keep working it and moving it more.
Right. Okay.
But yeah, there's a little bit right there. There's a little bit coming out. Survivor, Ed.
Yeah.
Survivor.
Yeah. This is good. I need bending. I think that's part of my problem, bending my legs.
Mhm.
Yeah, it's good to get that range of motion.
Yes. So even when I walk, it's like I walk stiff, you know?
Mhm.
A little more restricted over here, huh?
Yes. Yes.
Okay, all right. It's just hard. The stretch would be to try to use your leg on a chair.
Yes.
It's so difficult, but
Okay.
you're kind of trying to sit.
Okay.
Your butt to your heel is the
Yeah.
goal.
Okay.
Maybe in the bed, or
Right,
something.
yeah.
It's just so hard to know your strength to come up and down.
Okay.
That's how we can use your own weight to
Okay.
try to get your knee to bend. It feels like you're hitting a wall.
Right here,
Yeah.
yes. Right.
Yeah. This is the more powerful one right over here. This is the one that's all tight, and then so this quad doesn't want to stretch. Right there. All right, beautiful.
Okay. Wow, that's neat.
Just a way to help.
Oh.
Just keeping, just work those.
Wake them up. Wake 'em
Yeah,
up.
Right,
and you
right.
can do it at home.
Of course,
You
yeah.
know.
That's really neat. Very powerful.
Just like a few minutes there. And then right there, yeah.
Awesome.
Thank you so much. All right.
Thank you,
Thank you.
Doctor.
Thank you.